the reason why we're so proud and so happy of this award is because it's really showing what neglected disease are, what sleeping sickness is, and it's centered around Dr. Kande, his dream. He's been working, he's a Congolese physician. He's been working for 40 years on a disease that no one was interested in. He has been trying to find solutions and treatments so that patients would not die of this disease without anyone noticing what was happening. And he pushed and he reached out to researchers to find solutions and to find a treatment. And so what the film is showing is around his vision, how he managed to get us to work with him, DNDi and our partners, working with the National Sleeping Sickness Control Program to develop in a very stringent way, as much as we could, a new treatment, which will be an oral treatment for patients with sleeping sickness. And the movie is showing where we are treating patients, how we managed to do this research, and you would see at the end the emotion that he expresses when we finished the trial and we got that treatment out.
Thanks a lot, Nathalie, for this summary. Very, very, very helpful because of our technical problem here. So how was it important for DNDi to receive this Health for All Film Prize? What does it mean for you in your institution?
Well, obviously we're very proud, and I think the communication team and everybody that worked on this film was so proud to receive this first award. But it's because it's going to speak in another way of research, and more importantly, even on patients, on the healthcare practitioners, on all this environment that is not for by chance called a neglected disease environment. So we are giving the voice to those we're trying to bring support to. And this is why it's so important that the public can see and maybe better understand and connect with science papers that might seem very abstract. And here you can almost touch the problem.
Okay, and what DNDi is doing to make this film fully distributed, and so that as many people as possible could watch it, and how this could change, you think, the perception or the awareness about sleeping sickness?
Yes, well, we have an active communication team where, of course, having an award from the WHO is the best we could imagine for a disease like this, and having the support from the NTD department and being aligned with the objectives of whatever the WHO is trying to achieve. Having this on our website, having tweets, having all sorts of communication. I think also it's going to be very important for our Congolese colleagues to be seen as being able to do and conduct some very thorough research. So it has a lot of ramifications for patients, for research, and for the Congolese researchers as well. So it's great visibility, and this is why it is so important. And I think maybe it can bring also some interest to maybe other funders who were not aware and who might see that it's possible to do, very good research for needs that are not necessarily on the front page of all the journals and everything. And you can make things happen. You can do good, and we can show this with this movie.
Thanks a lot, Nathalie, again. So now I'll turn to Mwelecele, because this example of sleeping sickness and research about drugs is just one small component of the research on neglected tropical diseases. So Mwelecele, would you have, how is WHO organizing more research on neglected, it's difficult to pronounce as a French guy, neglected tropical diseases? Négligé, les maladies tropicales négligées, it's easier in French. And so how WHO is organizing all this research about so many diseases? And Nathalie mentioned the involvement of Congolese researchers. How do you manage to have researchers from all countries to participate into that?
Important to understand that these diseases are diseases of neglected populations. They are diseases of mainly people living in poverty who continue with cycles of poverty. So there's no commercial interest in making the tools that we have, the drugs, the diagnostics. There's really not a lot of commercial value. And here's why what Nathalie is talking about is so important. And what we do here at WHO is also very important. So at WHO, we look at what are the gaps. And then we prioritize how we can, what are the things that we actually need? What are the treatments that are actually needed to move forward and to address the targets that we have set for ourselves. And then based on that, we enter into collaboration. So the work that Nathalie is talking about with fexinidazole is work that was also done in collaboration with WHO. There's another drug for sleeping sickness, which we're working with DNDi. And there are other drugs, one for river blindness, which the work started here at WHO TDR. And so all that is the collaborative part. But then after that, as WHO, it's important for us to develop guidelines so that these treatments can be used and be used safely. And then finally, it's really important for us to ensure that through operational research, we actually ensure that the drugs, because having the drugs is one thing, ensuring that the drugs get to the people who need it is the other. And that's the important component of operational research that we put in. So this is the whole, WHO works on the whole spectrum of research, from defining the gaps to looking at the guidelines, to collaborating where necessary, and finally to ensuring that we do get access.
I'll come back on a question about this research aspect, but before we go ahead on that, could you tell us, because maybe the audience has not a full awareness of all the diseases concerned, could you give us a quick summary of how many diseases, where they are happening, who are affected, or what's the scope of the program you manage?
So we are huge. We manage 20 diseases, and they range from bacterial diseases to fungal diseases to parasitic diseases to even snake bite to rabies and so many other diseases. And again, these are diseases that predominantly affect the poorest of the poor and keep people in cycles of poverty. And so for us, the key is to look for what are the tools that we can use to ensure that people are protected from these diseases. But having said that, there is great progress that is being made. And we have seen in at least 42 countries have eliminated at least one of these 20 neglected tropical diseases. So there is good progress. It's still not the progress that we'd like to see, but it is good progress nonetheless. So it is a huge portfolio and with a lot of gaps, which I'm happy to talk about later.
Yes, thank you very much for this precision. So 20 diseases affecting tropical areas.
Absolutely.
And
tropical,
mainly the poorest in these tropical areas for people with harsh living conditions. So let's go back on the research. You mentioned research about treatment, and DNDi is called the Drugs for Neglected Tropical Diseases Initiative. So it's also about treatment. Mm-hmm. Before I give the floor to Nathalie on their other research, what about other research needed for these diseases, like diagnostic tools, training of health professionals, staff, and maybe prevention measures?
So what we have been doing this year has been developing an NTD roadmap from 2021 to 2030. And the most important thing of that roadmap was to look at gaps throughout the 20 NTDs. So we looked at all the 20 NTDs, and within the 20 NTDs, tried to look at what were the gaps. And based on that, some of the biggest gaps are gaps in diagnostics, gaps in supply chain, gaps in monitoring and evaluation, and gaps in funding and advocacy. So there are a number of things and capacity building was one of the gaps that we need. So in order to get to the targets that we've set for 2030, we need to address these particular gaps which I've just mentioned. And diagnostics, treatment is definitely one of them. Supply chain is another, making sure that when we do have the drugs, when we do have the diagnostics, they get to the people. And so all this is extremely important in the whole spectrum of addressing these diseases. And we're encouraged because we've decided to take a very strategic look at each of the diseases and see what are the key gaps. How can we move this forward and get the best result, and how can we achieve our target by 2030? Because our current roadmap ends this year.
I will ask you about that a bit later. I wanted to give the floor to Nathalie in DNDi. Based on what Mwelecele just said on different research needs, what about DNDi? Are you doing research only on drugs and treatment, or are you involved as well in socio-economic research, diagnostic tools, all these things which could be needed to fight the diseases in the field?
Well, thank you for your question. First, I'd like to say that what DNDi does is in alignment with the objectives that have been set in the roadmap. We contributed as many others in identifying priorities, but we are fully aligned. And we do drugs. We do development for drugs, and we can't do everything. And it's a complicated work. As you've seen, it took some time to get fexinidazole there. But so we have focused our work on a few of the 20 diseases that Mwelecele mentioned. We are focusing on sleeping sickness with this other treatment that we are trying to develop, which would be a one unique dose for sleeping sickness. But we're also looking at treatments for visceral leishmaniasis, that's called Kala-Azar, that is a deadly disease. We're looking at treatments for cutaneous leishmaniasis. We're looking at treatments for river blindness, for Chagas disease, and for mycetoma. In terms of linking with diagnostics and social sciences, it's, as you said, it's very key. So the way DNDi works is to set up partnerships. So we are working with diagnostic groups, diagnostics PDPs like FIND, for example. We're working with social science experts in the field to try to make, the tools that we need to bring, which is a solution for a disease, which would be a test and treat and access type of solution, focusing really on the development of new drugs. And maybe that's something which I haven't said yet, but everything we do is based on partnerships. We also work, of course, with the industrial partners, like Sanofi for in the case of fexinidazole and in the case of the new treatment for HAT, and many others to help us to bridge, the needs to get to this final goal of a new treatment for some of the neglected tropical diseases.
Thank you, Nathalie. Thank you. I have another question for you, and I will ask the same to Mwelecele about implementation of actions. In your film, A Doctor's Dream, happening in DRC, the Democratic Republic of the Congo, you mentioned that in your summary, that local researchers have been involved, and that also you had a clinical research in the field in remote areas of Congo, and how the COVID pandemic, maybe not in this country, but in all the research you do in the field, has the pandemic already affected your work in the field in terms of research, and does it slow down the kind of result you could provide in the future?
Yes, it has. It has because, it has for many reasons, but essentially because sometimes you have hospitalized patients, so you have to make sure you wouldn't put them at risk with these terrible diseases, with COVID, to mix patients with NTDs that go to hospital and meet COVID patients. That would probably increase the risk for the patients with NTDs. There have been some just pure access difficulties to reach out to the patients, or for the patients to reach to the centers. It's been affecting our clinical trials a bit, I have to say. Some recruitment stopped in the study in Sudan, for example. We had to hold it, also because there was a high number of cases in Khartoum. So it has obviously affected us, and I think the worry is that it's also affected the NTD staff all over the place, and Mwelecele is better positioned to speak about this. But and I think the other danger is that we forget the NTDs, and that all the attention is derived to COVID, which is very important. But NTDs are very important too. And if we don't do anything, the rebound might be really bad.
Okay, yes, indeed. They have been neglected for decades already. And if because of the pandemic, it would become even more neglected, that would be certainly a very huge problem for fighting those diseases. Mwelecele, she mentioned, Nathalie mentioned that indeed the WHO has maybe done some research about the impact of COVID pandemic on both the access to treatment, access to diagnostics, and so on, all the actions you're implementing. You studied in the WHO the impact already of these 6 months of pandemic?
So what we've done is, through modeling, tried to look at the different diseases that we work on. And one thing that I did not say is that we, for most of the NTDs that we're working on now, we are using donated drugs. So we have donations from pharmaceuticals, which we then distribute. And so we had to very initially give out a kind of information notice to stop all mass drug administration. And so that was a very big blow for countries. But we knew that we couldn't guarantee that it would be done safely, so we had to stop. In the meantime, we worked on models to try and see what would happen if we continue for over 6 months without treatment. And the current picture was between then, early March, and the end of the year, we would, in terms of a lot of the neglected tropical diseases that require mass drug administration, meaning a tablet every year, once a year, those will not be affected as severely. But the ones that Nathalie is talking about, the ones where you need to be in a hospital setting, the ones you need to go to a health center, those were the ones that we are still working on in terms of looking at the impact. But those are the ones which are most affected. And the other thing was, of course, the drug availability because of just because of sheer logistical issues as well. So those impacted the programs quite negatively as well.
Okay. Just a quick question. Is this pandemic, COVID pandemic, affecting all the NTDs activities in all countries the same way, in concerned countries by NTDs, or is it more important in some countries than others?
So initially it was affecting all countries the same way, but then other countries decided to innovate and find different ways of delivering these treatments. And so based on that, we then gave a new advice. WHO gave a new advice on how to reopen and restart these programs safely. So now a number of countries, around 17 countries in Africa, have begun these programs. But the other good thing maybe about the NTD program is that a lot of the NTD community health workers have been used to support COVID. And that is really great. That's something that we always forget. But these community health workers, which have been instrumental in running the NTD programs, have been very, very useful in supporting COVID messages, in going around supporting issues around hand washing, etc.
Another big issue we have to face, and for more time than COVID, is climate change. We say tropical diseases. So could these diseases happen in the future in non-tropical areas? Do you think there's a burden for other countries possible?
Absolutely, absolutely. And we've seen with, for example, there's dengue and chikungunya, for example, in 2010, started being seen in many countries in Europe. And that had never been seen before. If you look at dengue before 1990, only 7 countries reported dengue outbreaks, and now we have 129 countries reporting dengue outbreaks. And a lot of this is due to climate change.
Yes. Sorry, we are going to close soon the program. Maybe for the conclusion, I will turn to Nathalie for the last word, but would you tell us very briefly, in the future, what are your hopes or what are your expectations for the world community to put in place things that could help areas, but then, as you just mentioned, even non-tropical areas fight these diseases? What's the program of action?
The program of action is the roadmap. We have the roadmap. It takes us from 2021 to 2030. It addresses all these issues, including climate change. It's across the board, and it looks at all these 20 diseases. And so we have an opportunity to use this roadmap with its 3 major shifts, focusing on communities, focusing on multi-sectoral action, focusing on country ownership, and focusing on integration. And we will make the changes that we need to do.
So I suppose people can find this roadmap online.
Absolutely.
On the WHO website?
Absolutely.
Okay, so you can go there and check on the website of the World Health Organization for the part on neglected tropical diseases. Nathalie, same question for conclusion. What about DNDi in the future? Well, do you have a roadmap, as we use this word in WHO?
We do. We have a strategic plan, and you will hear about this soon. But we keep with our objectives of continuing to address the needs of neglected populations, making sure that with the researchers in the endemic countries, by building partnerships, by working together, by sharing the goals, by understanding what is the key need and how to bring all the partners together, and work on a plan, we can achieve this. And again, I think this film shows that with also sometimes exceptional individuals, with all this strength they have and all this motivation, we can make change happen. And this is our plan for the next 8 years. Thank you.
Thank you very much, Nathalie. Thanks a lot. And thank you to Mwelecele again for being with us today on this discussion about your winning film. I have a good news. We managed to solve the audio issue we had to show you the film, and we are going to play it now for you. Before we launch the film, so that you can watch it in full, discussion instead before, never mind. Please check on our website for the film festival. We have all the other YouTube lives, and maybe it will be available also on Periscope and other, but for sure on YouTube. We have a series of 7 more to happen, one tomorrow in French. So if you know people speaking French, please invite them to join. It will be about health promotion and education for health, based also on the film festival winners. And we are going to have much more in the coming 2 weeks until the 23 October. And 23 October will be the launch of a new call for films for 2nd edition of the Health for All Film Festival. So now let's watch A Doctor's Dream, produced by DNDi.
Le cauchemar de tout docteur, c'est de tuer son patient. La maladie du sommeil, ça fait peur, parce que la maladie du sommeil, vous voyez ces signes d'agressivité. Vous avez les signes de quelqu'un qui devient fou. La maladie du sommeil ou la trypanosomiase humaine africaine, c'est une maladie infectieuse parasitaire, parce qu'elle est transmise par la mouche tsetse.
The fly injects a parasite that circulates, goes into the blood, the lymph nodes, and later on will go in the central nervous system. And then eventually, if they don't have treatment, they will fall into a coma and die.
The last decades of the 20th century have been very productive in terms of new treatment, but nothing happened for those very neglected populations. Personally, when I was working with MSF during the 80s, 90s, I was confronted to a situation that was particularly dramatic, because the only treatment available to treat sleeping sickness was Mwelecele, an arsenic derivative, killing 1 out of 20 of patients because of toxicity.
It was described by patients as fire in the veins.
Dans mes prières, j'ai dit, Dieu, est-ce qu'il n'y a pas moyen d'éclairer ces chercheurs pour qu'ils trouvent un médicament facile à prendre pour soigner ces gens qui meurent, ne fût-ce qu'un comprimé.
The first step has been to improve the situation with a combination of nifurtimox and eflornithine called NECT.
So this is NECT, and all this is for one patient.
Le NECT, c'est un bon médicament, très efficace et qui guérit plus facilement. Mais c'est la logistique qui est lourde, parce que c'est fait, il faut transporter ces cartons et l'amener dans le milieu où il y a des malades. Souvent, ils sont dans des forêts, ils sont dans des villages.
This treatment is available only for the second stage of the disease, so you need to go through a very difficult and painful lumbar puncture that every patient needs to be confronted with.
Ceux qui viennent à l'hôpital, on est obligé de les garder parce qu'on doit contrôler la perfusion. Ça doit se donner en intraveineuse.
And the consequence is we wanted to have an oral treatment to treat all the stages of the disease. So we started our research on this field with the basis that one class of drugs, nitronamidazole, was having an effect on this sort of parasite. So we have organized a data mining of all the different compounds of nitronamidazole coming from university, coming from pharmaceutical company. One presented the characteristic of what we were looking for, a molecule that was called fexinidazole, and it was developed during the 80s and abandoned because of lack of interest of developing a product for parasitology.
Sanofi had the molecule, but we partnered with DNDi, who brought their experience from preclinical research and being able to do the clinical trials in these very difficult to reach areas.
We started the study in 2012 in DRC and Central African Republic. It was incredible to have to think about how you would do sophisticated clinical research in an unsophisticated setting.
La RDC est un grand pays et la logistique elle est lourde.
There was poor infrastructure, lack of scientific lab equipment, no one trained on doing clinical research, and the political instability in these regions. To overcome these challenges, we had to bring electricity. We had to bring microscopes. We also brought some technology like internet and satellites to make sure we would have the connection. We did training of 200 people in good clinical practice, in pharmacovigilance, to make sure that they could comply with what is needed to have a new drug registered according to international standards. We supported the national programs with cars, with boats, to go and look for patients. We work with the best teams, those that know how to diagnose these patients, those that are treating these patients.
Abanye oyoka soni. Bana nabelaki, nakomaki makasi, nalamba, nakenda zamba, nalamba kitoko pe na bana nanga toza bien. Tata ilo te makasi na nzoto.
Patients can be treated much closer to where they live.
On a confiance aux patients et c'est bien.
We're on the path to elimination of sleeping sickness.
It's not utopia anymore to be able to do this incredible research in these incredible conditions.
If we bring the right partner together, we can achieve the best science for a very neglected population.
Le fait qu'ici, d'abord, il rejoint mon rêve. C'est merveilleux. C'est merveilleux.